We are going to run quickly.
Mhm.
So, they
Mhm.
give a patient with hereditary nephritis, sensorineural hearing loss, and cataracts. Hereditary nephritis, sensorineural hearing loss, and cataracts. What's the most likely diagnosis?
I don't understand. What can you repeat again?
Hereditary nephritis,
Yeah. Mhm.
sensorineural hearing loss, and cataracts.
Medical pain. I don't know.
Think of the organs that are affected. So if you can group it into the three structures affected.
Ah, I forgot.
Okay, it's a collagen mutation, a type of collagen mutation.
Yeah, yeah. This is Alport.
Alport syndrome, right?
Yeah. It's like I have the idea, but I need more options.
You need options. Okay, so it's much more preferable if you can come up with answers without options. That way, even if you see options, you would be even more guaranteed that you're getting it right. Right?
Mm.
Alport syndrome. What is the pathophysiology of Alport? Where's the defect?
Yeah, so it is a type 4 of collagen
Collagen type
defect.
4, right?
Mm-hmm.
It's a defect in
Yeah.
collagen type 4. So Alport what can't see, can't pee, can't hear.
Mm-hmm.
Which diseases can't walk?
Can walk. Mm,
Can't
I don't
see,
know.
can't pee, can't walk.
Can walk. Um, no, it's great. I don't remember.
All right. This would be reactive arthritis,
Oh, so AL.
right? Reactive arthritis.
Mm,
Reactive arthritis can be caused by a number of things. What's the one big one? What infectious
well,
organism?
we have ankylosing spondylitis.
No, ankylosing
It,
spondylitis is one of
uh,
the seronegative spondyloarthritis, right?
yeah, arthritis.
But it's not a type of reactive arthritis. Reactive arthritis is its own disease. Ankylosing spondylitis, not arthritis, is its own disease as well.
Mm-hmm.
So, which infective organism would cause reactive arthritis?
Reactive arthritis. Oh yes, that is no, this is
If you don't remember anyone, you should at least remember chlamydia.
yeah, chlamydia, salmonella.
Chlamydia trachomatis. Very important. Chlamydia trachomatis, sexually transmitted infection. How do people with ankylosing spondylitis present?
Well, the bamboo spine,
Bamboo spine.
the uh,
This is not how they present, though.
we
This is what you see on X-ray,
no,
right?
yeah,
Okay,
it's
so
gonna
yes.
it's gonna be like pain when it's in rest.
What kind of
Actually,
pain?
like the
Pain
moment.
where
Sorry, what kind of pain? In the spine. I don't know how to say it.
hip,
It, it's
low back pain.
related. No,
Yes, what did you call it?
no. It's something with spondylitis.
No,
I
you,
don't know.
you literally just said the word.
Sacroiliitis.
Sacroiliitis.
Yeah.
This classically a 35-year-old patient, for example, middle-aged man
Mm-hmm.
with low back pain. Very classic presentation, right?
Mm-hmm.
Middle-aged
Yeah.
patient with low back pain. Do you remember the differentials for much older patients, say 65 plus year old man? with low back pain. Give me differential diagnosis.
Okay. Multiple myeloma,
Multiple myeloma.
prostatic cancer. Well,
Metastatic prostate cancer.
prostatic, yeah.
What else?
Pot.
Pott's
Mm.
disease.
Mhm.
This is vertebral TB, right?
Yeah.
What else?
The one that is yeah, that was such
Osteoarthritis,
osteoarthritis. Mhm.
right? Osteoarthritis.
Okay.
So we have multiple myeloma, metastatic prostate cancer, Pott's disease or vertebral TB, and osteoarthritis. How did we treat chlamydia? How do you treat chlamydia trachomatis?
Chlamydia we treat with ceftriaxone.
Say that again.
No, ceftriaxone.
Ceftriaxone. No. Which of your sexually transmitted infections do we treat with ceftriaxone?
Or Neisseria.
Neisseria gonorrhea, right? So what do we use for chlamydia?
Another one. I don't remember.
Doxycycline,
Doctor.
azithromycin. And of course, you add ceftriaxone to cover for Neisseria gonorrhea because there's frequently co-infection between both of them, right?
Yeah.
What was the mechanism of action of doxycycline?
Doxycycline. Okay, doxycycline. There is a okay, it's a doxycycline, so it is they block the protein synthesis of
Inhibit protein synthesis. Okay, how? Yes, go ahead.
yeah, it is they block the 50S protein.
50S.
No, 30.
That they bind 30S ribosomal protein and inhibit what?
The 23.
No, and
Um,
inhibit amino acyl tRNA, right? They
yeah.
inhibit amino acyl tRNA. Do you get that?
Yeah.
What's the side effect of doxycycline? Doxycycline is a tetracycline.
Yeah.
Side effect.
Side effects. Side effects. Doxycycline. Nephrotoxic.
Nephrotoxicity. Is that what we want to look for really?
It was I'm trying to remember that.
All right. So there's photosensitivity, right?
Mm,
There's photosensitivity. There is bone discoloration or teeth discoloration specifically. But nobody will really ask you about teeth discoloration, right? And then they inhibit bone growth. They inhibit bone growth, especially in young people, very young people, children, right? And of course, if a pregnant woman uses this, it's also going to inhibit bone growth in the fetus. And so these medications are contraindicated in pregnancy.
mm, mm, mm.
These medications will be contraindicated in pregnancy. Do you get that?
Yeah.
So tetracyclines like doxycycline, tetracycline itself, minocycline, and so on, will cause photosensitivity. That's the big one. You're looking for the 18-year-old, 20-something-year-old teenager, adolescent, whatever, that goes on the beach, for example, and has these reactions on the skin. What's the most likely cause? This person had a sexually transmitted infection, was probably taking doxycycline, and now developed photosensitivity.
Okay, so it's like specifically.
Mhm. You
Yeah,
get that?
that's the one. Okay.
What's the mechanism of resistance?
Uh, that is the one who have plasmid.
Well, yes,
Plasmid.
they gain plus they could get plasmid encoded what? What are they getting from the plasmid?
What I can get it. I don't know. What I can get it.
So what's the plasmid doing for them? How is the plasmid helping them?
It's part of the bacterial cell.
No, they get plasmid encoded pumps.
Uh,
Plasmid encoded pumps. What's the function of these pumps? To increase efflux of the medication from the bacteria. So they decrease influx and increase efflux of the medication out of the cell. Does that make sense?
okay.
So remember tetracyclines, they inhibit amino acyl tRNA. They would cause photosensitivity, teeth discoloration, inhibit bone growth. So pregnant women should not be taking it. And remember that people taking tetracycline should not be taken bivalent compound containing substances like milk with calcium, magnesium,
Mm-hmm.
right? Because they will decrease the absorption of tetracycline. And the mode of resistance is going to be plasmid encoded pumps that will decrease influx and increase efflux of the tetracyclines.
Okay.
Do you get that?
Yeah.
All right. We saw doxycycline, we saw azithromycin. What's the mechanism of action of azithromycin? First of all, what class of medication is azithromycin under?
These are fluorocarbon. Sorry, macrolide.
Macrolides. Azithromycin is a macrolide. Azithromycin is a macrolide. We have other macrolides. Do you remember what they are?
Yeah, that yes, they inhibit the 50F ribosome.
Okay, they inhibit 50S ribosomal mechanism of action now. They inhibit 50S ribosomal subunit. Okay,
but the specific it binds the 23.
good. So they bind to the 23S of the 50S, right? Ribosomal subunit. And inhibit what?
Inhibits the protein synthesis, but there is a special translocation.
Translocation. Very good. They inhibit translocation. Very important to remember that. What are the other medications that are also macrolides? So we have azithromycin. There are three of them you have to know at least.
Yeah, clarithromycin, clarithromycin, and erythromycin.
And erythromycin. Clarithromycin and erythromycin. What was their side effect?
The side effect, remember, gastrointestinal. I don't remember. It's macro.
Okay, there's a mnemonic for you in your first aid. Macro. Okay. What was the M?
That is motility.
Motility. They increase
Or the
GI motility, right? They increase GI motility. And because they increase GI motility, what can we use them for? We use them in people with gastroparesis, for example, post-surgery gastroparesis, for example, right?
Yeah.
Okay, what else?
Gastroparesis. Okay. The A is for arrhythmias.
Arrhythmia.
Remember, they prolong the QT.
Any form of arrhythmia at all. What's the C?
The C is cholestatic.
Cholestatic. Cholestatic what? Hepatitis.
Hepatitis.
So they have hepatotoxicity. That's what it means. Then, of course, there is rash and what?
Eosinophilia.
Eosinophilia. You want to remember that with your macrolides. Which of your macrolides are P450 inhibitors? Which of them are P450 inhibitors?
Oh, the macrolides.
Yes.
The erythromycin.
So if you organize them, azithromycin, clarithromycin, erythromycin, remember that the last two are the P450 inhibitors. So clarithromycin and erythromycin are P450 inhibitors. Do you get them?
Yeah.
All right. What's the mechanism of resistance against macrolides?
It had to be with the 23
Okay.
RNA
What happens to the 23 years? What happens to it?
methylation.
Methylation.
It prevents binding of the drug.
Okay.
Mhm.
Very good. So the mode of resistance is going to be methylation of the 23S ribosomal subunit. There is one medication that sounds alike, similar to your macrolides, that you have to not mistake as for a macrolide. That will be clindamycin. You remember that although it's clindamycin, like erythromycin, clindamycin is not a macrolide. What's the mechanism of action of clindamycin though? It's basically the same thing.
It's like the same, but it so just only binds the 50S particular.
Right. So it also inhibits translocation at the same 50S ribosomal subunit. So clindamycin basically does almost the same, exactly the same thing technically as macrolides, but it is not a macrolide. Do you get that? When you use, it's a broad spectrum antibiotic, of course, right? It's a broad spectrum antibiotic. What does this mean? When you use clindamycin, what side effects are you concerned about?
There is the membranous colitis.
Membranous colitis. What's the organism that is responsible for pseudomembranous colitis?
It's Clostridium difficile.
Clostridium difficile. Right? And how do we treat these guys?
Vancomycin and
Fidaxomicin. Vancomycin, fidaxomicin. Right? What other medication did we mention initially? Maybe we'll do some antibiotic review right now. We've talked about doxycycline, we've talked about azithromycin and the other guys. Ceftriaxone. What class of medication is ceftriaxone?
It's a cephalosporin.
It's a cephalosporin. What's the mechanism of action of cephalosporins?
They inhibit the beta-lactamase.
They inhibit beta-lactam cell wall. What's their side effect?
Side effects. Side effects cephalosporin. The eye.
What did you say?
The eye.
The eyes.
Yeah.
What do they do to the eyes?
No, GI.
GI. What do they do? Did they really cause gastrointestinal side effect as much? I don't think so. Not exactly.
Hypersensitivity.
Hypersensitivity reaction. What else? Vitamin K deficiency. Nephrotoxicity, right?
No.
Their nephrotoxicity is exacerbated when you use them together with what? Aminoglycosides. Remember that?
Yeah.
So aminoglycosides, if you remember, they cause nephrotoxicity, ototoxicity, neuromuscular blockade, and they are teratogenic, of course, right? And if you use them together with cephalosporins, then you increase even more the likelihood that the patient is going to have nephrotoxicity. What's the mode of resistance against cephalosporins?
They produce beta-lactamase.
Beta-lactamase in the form of cephalosporinase, right? Cephalosporinase is a type of beta-lactamase, right? What else? They can change the penicillin binding protein. Remember the mechanism of action. They inhibit beta-lactam cell wall. They inhibit, what do we call it? They bind penicillin binding protein or inhibit penicillin binding protein, right? Transpeptidase, if you remember. Just like penicillins, They inhibit transpeptidase. Transpeptidase is a penicillin binding protein. You get it? They inhibit transpeptidase. So part of the mode of resistance is a change in the penicillin binding protein, a change, structural change in transpeptidase, for example. Does that make sense?
Yes.
All right. And those are a few things you want to remember.